Now we're going to talk about another very common surgery which is done in orthopedics, and this is what is known as the joint fusion surgery. So joint fusion surgery, you can also say it is what? Arthrodesis. Okay, joint fusion surgery, also known as arthrodesis. So it's just a surgical procedure where a joint is now permanently fused so that the bones will now grow together into a solid structure. Like there's a joint, so in between it maybe there's a space or there's a cartilage, but you just want to fuse everything. Okay, so it's a surgical immobilization of the joint by fusing the bones that are across it. So if you fuse the bones, of course the joint is no longer there, so it can relieve pain, it can bring about stability. Okay, so this is where other treatments have failed. Do you understand? So surgeons remove damaged cartilage, align the bones, then hold them together using plates and screws or rods until they fuse together. Of course, joints that fuse together, there's no movement, there's no flexibility around that place again. But this one is to bring about a permanent solution to an issue that have been pressing along. Okay, so indication is used when there's severe arthritis, that's osteoarthritis or rheumatoid arthritis. And there's joint instability after a trauma, infections that have destroyed the joints. They have done joint replacement but it's failing. Okay, so common joints that are fused include the spine joints, the ankle joint, the wrist joints, the finger joints, the sacroiliac joints. So advantages is to relieve the pain that the patients have been having for a very long time. It's to restore stability and it's durable. Okay, once you put it, it's a permanent solution.